Second diagnosis, chronic lumbar, which is called as a fibrositis. So we have seen the fibrous tissue is there. The multiple fibers are there and they get inflamed. Chronic fibrositis, chronic lumbar. Second word, chronic lumbar backache. Patient is having backache since last 6 months, last 1 year. Continuous type of pain. Again, the diagnosis is clinical. If you do X-ray, you will never get anything. If you do CT, you will do myelo. If you will do MRI, nothing. Everything finds to be normal. Diagnosis is clinical. You have to just examine the spinal cord. Lumbar region examine करायचा. How to examine a lumbar region? काय करणार? Lumbar region तुम्हाला पाहायचं. What you will do? Anyone? Huh? ऋषिकेश. Yeah. तुम्हाला सगळ्यांना लंबर स्पाइन कसा एक्झामिन करायचा दॅट यू विल फाइंड इट आउट. तुम्ही तिथं जागेवरून उभे राहून पाहिलं, ज्यांना बसून पाहता येईल त्यांना तिकडे एक काम करतो. आता सगळ्यात आता ज्या वेळेला तुम्हाला when you have to examine the lumbar spine, come on, इकडे आले तरी चालेल तुम्ही. This is too important. Whenever you have to examine lumbar spine, कुठे आले काय प्रॉब्लेम नाही. You have to learn the practical. Ask the patient where exactly the pain is. Most important thing, it is your duty to ask where exactly the pain is. And then you have to first examine. If he says the pain is there, you have to start with lumbar. So number 1, number 2, number 3, number 4, number 5, where the sacroiliac joint is there. So sacroiliac, इथपासून ते इथपर्यंत पेन कुठे? It is where on the vertebra, whether it is on the paraspinal muscles, on the lumbar sides, or whether it is there on the lumbosacral. So first important thing is that you have to examine clinically where exactly the pain is there. So ask the patient lie down on abdomen with a head straight, and then you have to examine. This is first important thing which you have to do. Okay, good. We'll go one by one.